I wanted to take this opportunity to show appreciation and gratitude from the Ontario Pharmacists Association to all of the healthcare providers who are providing optimal and exceptional care to patients throughout the COVID-19 pandemic. In particular, I want to thank the 20,000 plus pharmacy professionals in the province, and indeed the 50,000 across the country, for remaining open and ensuring patient continuity of care during very difficult times. Many stores have implemented measures to protect both their patients and their staff from spread and infection of COVID-19, including implementing things like plexiglass and helping to manage with physical barriers and creative ways to manage the flow of patients into their stores. This is not an easy time, but you stand up and you're ready and you serve the communities that you live and work in very well. It is for that reason that OPA has, from day one of the pandemic, advocated to government and public health officials for formal designation of pharmacists as essential healthcare workers, which will give us priority access to personal protection equipment, or PPE, of a government stockpile. That is taking longer than any of us would like. So in the interim, we have established and sourced supply of PPE for Ontario pharmacies. This is limited to Ontario pharmacists due to supply challenges, and certainly we can extend our agreement with the supplier to other health professions as well as outside of Ontario when supplies are replenished. We are still working through some of the logistics as we look to implement this and streamline the ordering process, but it's really important as one of our main priorities to protect the front line. In addition to advancing causes around personal protection equipment, we are advocating on your behalf to get funding and scope of practice for things like emergency prescribing, which is critically important at this point because many physicians have closed their offices. And some of them are doing virtual care. Some of them are working in other parts of the health system to help out, such as palliative care. But the reality is many patients are being dispersed and they're coming into pharmacies looking for access to care. And we have the expertise. Pharmacists are ready to provide this, but we need the tools and we need government to accelerate the adoption of both policy and regulations to enable us to do therapeutic substitution. Certainly with the increase in drug shortages, that becomes a very important tool. And to expedite the environment for 8 of the common ailments, ones that are certainly painful for patients, where they may end up in emergency departments of hospitals or in doctors' offices. We want to avoid that. We want to create capacity in the system, particularly at a time when the system is being overtaxed. This is our opportunity to be able to give those tools to pharmacists for things like assessing and treating uncomplicated urinary tract infection or GERD as 2 such examples. But I also wanted to point out that we understand what's happening on the front lines and operationally. We understand those challenges and the risks that you're taking. And we know that this is a challenging time on the economic front as well, which is why your association has advanced the proposal for an economic aid package that will directly subsidize some of the costs on acquiring PPE, making operational changes in the store, as well as things like covering the copay on the second and third dispense, since we implemented the new policy to protect and maintain the supply chain of a 30-day limit on medications. We don't want a cost transfer to patients, and we don't want pharmacies to have a further economic hit given the broader operating environment. So we've asked government to cover the copay on the second and third dispense. Business as usual on the first dispense. It's the same that we're talking about as we look at some of the mechanisms being put in place to help patients and deliver medications to their homes and where they live. We're asking the government, as part of this whole seniors package, to cover the costs of home delivery, or at least subsidize those costs. We're reasonably optimistic that not only are we having daily conversations with both Minister's Office, Premier's Office, and Ministry of Senior officials, but that they're hearing our message and that they understand through our message of what's happening on the ground. We know these are challenging times and that you're doing everything you can to take care of your patients. And as part of our commitment to you as members and non-members across the province, we have developed, and now we're in version 2 of a pandemic resource guide that gives you tips and best practices, including in-store posters and valuable resources to use as you manage through this process. We know that alone isn't going to be the difference maker, but it's one step in the direction of being able to provide you with every bit of communication, tool, and information we can in order to make your job easier. So once again, as the CEO of OPA, I want to show my personal gratitude to pharmacy professionals, and I want you to know that we're fighting for you every day, and we're fighting for you on multiple fronts, and that we're going to do this together. And this is our opportunity not only to shine and showcase what value we have to the public and to the payers, but to really accelerate some of the critical things that we need to have as a profession to move forward. We are working on many other items, but right now all of our efforts are focused on COVID-19 and providing as much support as we can. Thank you, and once again, we appreciate everything that you're doing.